of America's worst drug crisis ever.
Opioid addiction is reaching epidemic levels.
At least 91 Americans die every day from an opioid overdose.
America's opioid crisis began with the rampant abuse of prescription painkillers. Australia is determined to avoid the same.
We do not want in Australia to be the situation in America. We have 1,000 opioid-related overdose deaths a year in Australia. That is 1,000 avoidable deaths.
Last year, our federal government started cracking down on prescription opioids like Panadine Forte, oxycodone and fentanyl. It made codeine prescription only and put GPs on written notice that their scripts for the powerful and highly addictive painkillers were being monitored.
So all we were saying is that these are the data, look at your practice and reflect, and if you're using opioids in non-cancer chronic pain, you should consider your practice.
Last year, the Chief Medical Officer sent a letter to nearly 5,000 GPs with a high rate of prescribing opioids. What was meant as a well-intentioned intervention had a chilling effect on many doctors.
It felt quite threatening. It didn't come across as could you examine your practice. And it was stressing me, so I actually threw it away. Hi there, come in, have a seat.
Dr Kate Chaplin is a GP on the Gold Coast.
How are you doing today? Good. Well, unfortunately, some of my colleagues did decide that they weren't going to see people anymore. So a few people came and approached me, would I be prepared to take them on?
In the past year, Dr Chaplin has taken on around 30 chronic pain patients who were dumped by their own GPs after their doctors received the same warning letter she did.
I feel I might be at risk, and audit by Medicare seems to be bandied about a lot. However, I just felt clinically that it would be more at risk for patients to be suddenly stopped.
There's a zip line going across, look.
Oh, I'm so going to get on that.
Tarina Hackshaw is one of Dr Chaplin's new patients.
I have rheumatoid arthritis in every joint except my elbow. Some days I can't even get out of bed. Some days when it's really bad, my kids have to help me on and off the toilet. I struggle just to feed my son and have a shower.
For the year and a half before Tarina met Dr Chaplin, she was unable to get a Panadine Forte prescription with devastating results.
If you're in pain 24/7 for 9 years, it becomes so debilitating. You wake up and as soon as you open your eyes, you're in pain. You just don't want to be there anymore.
1 in 5 Australians lives with chronic pain. For the past few decades, opioids have been increasingly prescribed, hitting nearly 16 million scripts last year for 3.2 million patients. But in the last 5 years or so, the medical view of these drugs has changed.
They are of little value in managing the chronic pain syndromes and have a serious range of adverse effects, the most serious of which is obviously death from overdose.
Now science has changed, we need to do differently, but it takes time to change towards that science. Breathing in, reach your hands up nice and high, beautiful, reach it up and down.
Joyce McSwan runs a community-based pain clinic on the Gold Coast which teaches alternative pain management techniques. It's been overwhelmed with chronic pain patients who've been suddenly cut off from their medication but not given any other support or alternatives.
The resources around Australia overall are very much lacking. And I suppose this was the quandary in terms of the fact that we have a opioid situation and we have a pain, chronic pain need, and yet we've got a lack of also services.
It's not easy to get into a pain clinic. Been on waiting lists since March last year.
Jodie Carter lives in regional New South Wales. She's studying to become an accountant and is a mum of 2. She also has complex regional pain syndrome and other pain conditions for which she's been prescribed opioids for 25 years.
I've tried other things. I've tried interventions that are outside the scope of opiates, but nothing other than that has worked for me.
Earlier this year, Jodie's former GP got a letter telling him to cut back her pain medication. Since then, she's tried multiple different doctors in her area, but none will write her an opioid script.
Whether the GPs got the letter or they didn't get the letter, the general consensus has been that if we prescribe, we're going to get in trouble, so it's better to not prescribe.
Jodie has stretched out that last script she got in March until now, but estimates she's only got a week of pills left.
I don't know what that future holds then. I don't know how I'm going to function. I don't know how I'm going to finish uni. I don't know how I'm going to look after my kids.
There's general agreement between patient organisations and doctors' groups that reducing opioid use is a valid aim. But there's also a definite perception of heavy-handedness, which is having unintended consequences for some of the most vulnerable Australians.
Shortly following the letter, I was also beginning to get more inquiries from other patients of other doctors who were actually saying to patients that could no longer continue to see them.
Dr Paresh Dowda is a Canberra GP who specialises in aged and palliative care. In the last year, he's also taken on multiple new palliative care patients who were dropped by their own doctors.
It's really a shift of the problem. It doesn't necessarily mean the total number of opioid prescribing has gone down, or that patients are getting appropriate treatment.
These are anecdotes. I would imagine that a mature, sensible GP who is practising in palliative care, prescribing opioids appropriately, would read the correspondence that we sent them in an entirely appropriate way and keep doing what they're doing.
In June, following outcry from GPs, Professor Murphy was forced to write another letter apologising for upsetting doctors with last year's written warnings. Meantime, unable to find any local GPs to prescribe her nerve pain medication, Jodie Carter has been told she'll have to go to the hospital methadone clinic.
It's just made my own self-esteem drop to think that I've had to reach these levels just to get my medication.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.